Yep. So I would measure each one of those, superior to the line as we go up. I would write it in my format there so that I knew before the treatment what he was. 10 centimeters, 20 centimeters, 30 centimeters, and however far I needed to go up. If he had edema in his foot, I would measure 1 10 centimeter or 2 centimeters, or 2 sets of 10 down on that foot. And I would write that I'm following along the 5th metatarsal, or wherever I went with my tape. Okay? So now, we're going to put on a piece of stockinette, because we're going to put this plastic naugahyde sleeve on him and then add some compression. So he's going to sweat in there. Okay, and so we want to put something in there so his skin isn't going to stick to that. So we measure it out, making sure that we have enough. And these are one patient use. So if I was going to do his treatment again in a couple days, I would write his name on the top of this and just keep it down in the PT department or up in his room. And it cuts with scissors if the scissors are sharp, but ours aren't.
Yeah, we have a problem with those.
Kinesiotaping scissors might work from that drawer if you can't get it. But.
Give me a utility knife. Record that, did you?
I did. I heard you.
Jeez.
Yeah.
Wow, you can chew it off.
Sorry.
Okay, you can stop that. The purpose of the ICP, as I said, was to push the edema out so we can get it up into your body so that you can eliminate it. And there are some reasons why we wouldn't want to do that. And probably the main one is if you have congestive heart failure, so your heart's okay. Because we wouldn't want to push that edema up, make that heart work really hard if it couldn't handle that. Okay? And then you don't have any blood clots in your leg. Any PVD, vascular diseases, peripheral vascular disease, okay. And the leg looks good. There's no revascularization or wounds or anything on it. And you didn't have a fall or anything recently.
Nope, no falls.
Because we wouldn't want to do it if you fell and had a fresh hematoma or a fractured bone. That wouldn't be fun. Okay. And your skin is looking really good other than the dots that I put on you. I would document you have a little bit of a old scar on that knee. And if you could just roll that sheet up into there. And I'm just going to lift it up and look underneath, and we don't see any bruising or anything.
Sure, he appreciates you noticing.
Another reason why we wouldn't want to do this is if you had infection in that leg and you don't, and what I'd like you to do is close your eyes, and I'm going to just do a simple touch test and let me know when you can feel this.
I can feel it. Feel it.
And where?
Left side of my foot.
Okay.
Medial side. Lateral side. Medial. Lateral.
You're a smart patient to know those terms.
You do this yourself at home. Look how much money
Our goal for this is to get that leg pumped down enough that we can eventually purchase a job sock for you so that you'll be able to put this on at home and put the sock on at home. And so what we're going to do is use the pump and pump the leg down, and then we're going to ace wrap it.
Okay.
And again, if you just want to pull that stockinette up, I want you to really make sure that there's no wrinkles in this stockinette, because what will happen with that pump then is it'll make a wrinkle in there, and then maybe that fluid won't flow through there as well.
Okay.
I changed my angle.
Now this is our sleeve that we're going to put on, and it has been cleaned, so. And the reason we elevate this leg is so that it kind of helps that fluid flow downhill.
What's that called, Brenda? This
The sleeve?
It's called the sleeve?
Yep.
Okay, so we have
And
a
is
sock
this
and
an
then a sleeve.
all-around pressure?
Yes.
Or is it, it's not intermittent or whatever, like?
Sequential.
certain at the foot and the- Yeah, that.
It's not sequential.
We do not have a sequential pump.
Yeah.
Okay.
So
And so what is it called when it's an all-over one? Compression, just
Constant?
constant, sure.
sure, that works.
Okay, and then we're gonna hook this tubing up to it, and the tubing has two ends. One of them has kind of a little open area with a gasket on it, and that's gonna go into the machine, and then we're gonna turn it. And then we're gonna hook this up to your sleeve. And the one thing to remember when we hook this up to the sleeve is to put it in with a turning motion. And these sleeves for the intermittent compression cost about $300 to $500 a piece. They do come in different sizes, so people with shorter legs, smaller legs, you can get half sizes. They also come in upper extremity ones, and those are laying over there on the mats. And so you want to be careful that, one, you're putting the right end into here, because this end won't go into the pump. And the other thing, when you're putting these into the sleeve, put it in with the turning motion and take it out with the turning motion. And through experience, what I did one day at work was we were doing this on a lady, and I pulled it out and ripped the whole thing out of it. Yeah, and so it was like, okay. You can't just shove it in there. It has to go in and then turn, and it locks it. So then just tug it a little bit to make sure that it's locked into place. Okay, and I read in your chart that your blood pressure is 120/80? Okay, and so because we didn't get the millimeters of mercury, we're going to start at half the diastolic today, and then we'll see if we can increase that. So we're going to start at 40, and our inflation times are going to be deflated or inflated 3 times as much as the deflated. Okay?
Good. Say that again,
So we
please.
have 3 to 1.
It's an on-off ratio. How long your inflation is on compared to how long it deflates.
And then it
deflates.
Yep.
And then it pumps up again.
But it will take it a little while to inflate, so it'll be just a little bit here.
So it doesn't just
Okay?
blow up and just stay
Is it
there?
on right
No,
now?
Okay.
no, that would be bad.
Oh,
Okay,
That
so
would
I'm gonna
cause
turn it on.
potentially some issues with circulation.
Circulation issues, right.
It wouldn't improve it very much. It might actually occlude it, and that's one of the
Do you
risks you have
do-
with this at too
yes.
high pressures.
That's what I was wondering, do you expose the toes just to see if
Um,
there is any circulation?
If you can, usually the sleeves are so big you can't, but you could always peek in to check.
After it's been on and off a couple of times, then we look in there, we have him wiggle his toes, make sure they're not turning blue.
Blue, right? Cap refill or anything like that.
Yep, exactly.
And we want them elevated. You can use pillows or you can use the wedge. You would not want to use like a 45-degree wedge, because what that's going to do is make a blockage here. So you want a nice even flow on that. Okay?
Is that hurt, Patrick?
Doesn't hurt, but it's getting some pressure in there.
Oh, we got a leaker.
Yeah. And what you want to kind of do is pick that leg up to make sure that the air is going all the way around underneath.
You don't want a flat spot on the bottom of this.
Correct. Or a wrinkle in this sleeve.
What was the ratio you had that on, Brenda? 3 to 1?
3 to 1. So 3 on,
3 on,
1
1
off.
So is that 3 minutes? 3 what?
3 times as long as it's
Okay.
off, so it's just the ratio. So whatever your off settings. And there are some guidelines for it. They're not well-researched guidelines necessarily, so what we typically say is we use certain guidelines because we don't know for sure what's best, but 3 to 1 is pretty typical.
And it's
For
gonna
various
change.
causes.
Sometimes it'll go, 1 to 1. The research is
Right.
1 to 1, and then it goes
Right.
back to 3 to 1.
And so you might, if you don't get the effect you want with a patient with a certain on-off setting, then you might try a different one the next time. It kind of depends on the indication. We do this for edema. We also do it for those venous stasis ulcers to help promote healing. We're going to use slightly different parameters, usually less.
Your toes are nice and pink. Can you wiggle them for me?
So when you do this for edema,
Yeah.
how long can the effects of that last?
Well, that's a
Depends
good
on the
question.
patient.
It depends on the patient, but it also depends on what you do afterwards. Typically, after this treatment, Brenda's going to show you, we get the edema down. She measures and finds that the edema decreased. We wrap it or we put a sleeve on right after to maintain that. But it will depend on how much they're up, how much the leg is in a dependent position, and then just the severity of their edema and how easily it returns. So it's variable, but the wrapping after is really important to help maintain. Ace wrapping or sleeves, some sort of compression. Oh yes, that's a good point. Yeah. Yeah, going to the bathroom first is definitely good.
And when we went.
What I'm going to do now is ace wrap your lower extremity, and what I'm going to use is called a figure 8, and so every other motion will be going this way, and that will help that circulation and help that edema get pushed up. We're going to go a little tighter on the distal part and a little less tight on the top to help, again, keep that edema out of there. Because what will happen now if we let you get up and put those feet down and walk, that edema will just go back down. So we're going to try to keep it out of there as much as we can.
Can I ask another question? Can edema go away? If somebody gets it, if somebody's prone to it, do they pretty much always have
No,
it?
no. Less chronic edema can absolutely be treated and can resolve. Even chronic edema can ultimately resolve, for sure.
And what is the, how, you don't want this too tight, this bandage.
Would
What I
you
wanna
like
do
a
when I'm
percentage
done
of
is
stretching?
kinda snap it, and it should snap louder here than it does here.
Okay.
Does that
Yeah.
make sense?
It's not, she's not applying it super tight. Remember I talked about how you wouldn't apply for more than like a 50% stretch. You're doing way less than that, I assume. And this isn't all that stretchy anyway, but it is somewhat elastic compared to a completely non-elastic wrap. So there's a little bit of crossing each time. It's always tricky getting it around the ankle.
What
Much
you wanna
better at
do
it than
when
I
you
am.
do this at home is make sure that you don't have any wrinkles in it, because again, those wrinkles will not let the edema go. And you want to stay at a good angle, trying not to go straight around. And you want to make sure that all of your skin is covered, because anytime you have skin peeking out, then you'll have a pooling of fluid there.
Interesting.
So Brenda's using less pressure the further up she gets, so that the pressure is...
And if you unroll the bandage with the bandage flat to you, instead of doing it this way and having your fingers in there, it's a little easier. You can more roll it on instead of having to tug it with your fingernails. And you want to cover at least an inch to an inch and a half of your bandage. It's not for support. It's not like an athletic injury. So you can have a little bit more distance in there. And then the one thing to remember is, it seems like ace wraps always end on the bottom. And the other thing is that you don't want to tape this to your skin. You want to
His hair.
Agree, that would be not very good.
So that's high enough on this? In this
Nope, we're going to end them.
Oh.
Yeah.
Yeah, I'm just needing an example, just so I know.
And then we're going to get another ace wrap, because we want to go up to above there.
You enjoy being a patient, don't you?
I do, it's fun.
Yeah.
That's okay.
Well, you don't have to call it old.
Inexperienced. Seasoned.
It's just a pro. Pro. Just
John, you're
pro.
digging a deeper hole here.
And you're getting a little wider as you go as well, more away from that inch and a half, inch to inch and a half, it looks like? Or
yeah.
not perfect?
Because it should be less
Get a
pressure.
little looser.
Yep.
Okay.
And you can set that down. If he had a little larger leg, no offense, but a little larger leg, I could maybe go to the 6-inch
Okay.
wrap and
Yep.
put that on instead of the 3-inch. Does it feel tighter on the bottom than it does
On the bottom, yes, it does.
But it doesn't hurt.
Nope,
You can't feel your heart beating in it or anything.
nope.
Yes, it's amazing. again,
Would
we're
you
gonna-
have the patient not bend over or walk normal or?
I would have them move as much as they could, being aware that they need to watch for that opening area. And so what I have the patients do, I want you to do